Monkeypox has been declared a national public health emergency, and it could get worse, according to some people, as the school year starts. Joining us, Dr. Jeff Pothof, UW Health's Chief Quality Officer. Doctor, great to see you. The number of monkeypox cases that's going up. We're approaching 9,000 cases, and there's new concern after a daycare worker in Champaign, Illinois, right down the road, tests positive. I mean, what's the risk that our kids face with monkeypox?
You know, right now, I think that risk for kids is relatively low. I think one of the reasons we want to get on top of monkeypox is we don't want it to be this common disease that kids can come down with. We are seeing some cases in children, but they're relatively limited. And I think all of us have COVID in the back of our heads. It's just important to remember that monkeypox is much more difficult to contract than COVID, and likely a bit less dangerous than COVID too.
Let's talk about monkeypox. The way I understand it, correct me if I'm wrong, you need to have sustained contact with someone who has like one of those bumps or lesions, right? And with kids, I don't know, could they run into someone in a sporting event? I was reading in one article that one expert said that is a possible concern. How likely is it to catch monkeypox if, in our kids' lives?
Yeah, I think like in your example, two kids run into each other, one has monkeypox, one doesn't. Is it possible that the other one could contract monkeypox? I guess it's possible, but it wouldn't be that likely. It usually takes more prolonged contact with the lesion in order for someone to develop it. So I think it's important that we pay attention to monkeypox. I think it's important we think about our vaccination strategy around monkeypox, but I'm not too worried about, either of my kids going to school this fall and whether or not they're going to get monkeypox.
Now, the government's been pretty slow to react to this outbreak. They're now facing a vaccine shortage as a result of not bringing the vaccine from overseas quick enough. Now, health officials reported yesterday they want to stretch the vaccine supply out. Explain this to me, Dr. Pothof. What do they want to do? How's this work?
Yeah, so this is the plan. Ideally, plan A would have been to get enough vaccine where people who were exposed to monkeypox or have risk for monkeypox could get the two-dose series. That's a shot much like your COVID shot, your flu shot. But there is a study out there that looked at if we inject the vaccine subdermal. So for those of us who get like a TB skin test, that might be something people relate to. It'd be similar to that. If you use 1/5 the dose, you get a similar immune response. But it's just one study. So it's definitely a plan B that might be worthwhile while we try to build up vaccine supply. But ultimately, we should be trying to do the two-dose vaccine series for folks who need monkeypox vaccination.
Dr. Jeff Pothof from UW Health, we appreciate your time.
Thank you.